you. And I'm obviously off mute. Thank you very much. And I will be very quick. I've taken a bit of a different approach to this because in my role, I look primarily after the nursing staff, all of the health staff. And so I considered what I think the competencies of a smart nurse might need to be for the future, and how we can use technology to support nursing and to educate nursing and to connect with colleagues. But I will just quickly give you a bit of information, I suppose, about Australia or Tasmania. I work in Tasmania, and that is a very small island comparatively to the mainland of Australia, but it is about 95 times larger than Singapore. We have a population in Tasmania of 500,000 people. So we have an incredibly diverse population and a diverse or dispersed workforce. So that brings significant challenge in terms of communication, which obviously the technologies of today have enabled us to connect far more readily and rapidly. Australia as a whole has a population of about 26 million, and again has a dispersed population, but focusing more in capital cities. But in Tasmania, it is very dispersed. So I'm focusing very much on what the needs, as I say, of nursing actually are for the future. Predictions of nursing shortages in Australia are essentially, I suppose, alarming. Everybody knows that we have ongoing shortages globally. The revised figures, these figures have been revised recently, and it is not considered to be quite as dramatic, I think, as that, but it's still coming up under about 100,000 that is predicted that we will need. Certainly from my own service, I know that we're in the middle of a massive reform in relation to mental health, and currently I'm responsible for about 1,400 employees. We need to expand that by about 400 to 500 to actually realise the extent of the reforms that we've been provided money to develop. And that's the majority of those will be nursing. We obviously are using technology to create the data or to keep the data for those predictions, but that data obviously now needs to be accurate so that we can actually base strategies for how we might deal with the challenges that are being faced by us. And currently we look at, obviously, international recruitment as a way to solve some of these shortages. We look at training more nurses as one of the strategies. But the one that I'm more interested in is looking at how we can have greater attention and to look at growing our own. And technology obviously has a part to play in that, with the use of simulation and with the use of being able to connect, as we're doing now globally throughout certainly Tasmania, as well as broadly Australia and then internationally. So I think some of the qualities and some of the skills that we need as nurses and we need to develop are to be strategic and to be steadfast and assured of our place and our role, but also to support each other. And I think one of the challenges that we have with the technology is the speed with which technologies are being developed and the promise that technology will solve all our problems, when actually we also still need a human component in that, and we need to understand and use that technology wisely. And certainly in Tasmania, and I'm sure it's no different from other jurisdictions, we have a very different capacity within that workforce in relation to their ability to use and uptake technology. And I myself am personally challenged by often the speed with which new apps or systems for maintaining data are introduced that I have to adapt very quickly to and find that quite challenging. I think we have to consider our models of care of nursing and be mindful, but create workforces that actually are magnetic, where people want to come and work because they know that we're going to support them in workplaces where workloads are not overworked. And I think that we've seen with the introduction of technology, the capacity for us to become work poor or time poor in other ways than we were previously. And I know that in terms of my diary and management, it's often back to back with meetings because they're easily put into the diary now, because most of those are done through digital platforms. And there's great benefit in that, but there's also, I think, things that we need to be cautious of. Obviously, we need to be adaptable, agile, as well as being approachable, and we need to develop teams of nurses and ways of working, ways of thinking that enable that agility and adaptability, given the speed with which we're being asked to come about those changes. We also need to be resilient, obviously, and develop those skills of resilience within the workforce and maintain our levels of resourcefulness. And I include Rainbow there because we in Tasmania are committed to a diverse and inclusive workforce and respect for individuals and their own identification and also beliefs. And within that, we need to be transformative. And of course, the use of technology enables that. And we need to maintain our tenaciousness, but to do this together and work together. I think that we need to consider and focus on our circle of control rather than our circles of concern. So that we're expanding our circles of influence in relation to the work that we do and how that we go about doing that. I can personally feel a rise of anxiety and almost panic when I think about the demands of healthcare into the future and the difference in what I see as the workforce coming through from when I trained some over 40 years ago. And so I have to focus on my circle of control, which is the workforce, supporting the workforce, looking at how I can use technology to engage and join that workforce up so that they feel supported and connected. And I saw great opportunity through COVID where we had to come together as a state, that we existed very much in silos within my service. We have 6 clinical streams. They didn't connect very often. But during COVID, we brought them together. We forced them to come together through the technology. And through that, we could see that there was connection and a level of intelligence about how to use that technology developing. But we need to continue to robustly work with that. We obviously, as I say, this is my plan, this is my recipe for sustainable workloads and a satisfied workforce. And my current strategy is looking at how we can provide supervision, which the training for which is online and support staff to undertake that. But how do we then support a workforce, a diverse workforce, to connect through the use of technology to actually undertake and provide supervision to each other, as well as coaching, as well as mentoring across a digital platform. So I'm very interested in the exploration of how we might actually be able to do that and enable that. Primarily my skill, the skill base that I think that we need as smart nurses for the future, is to work on what I call the ninja skill of being the calm in the eye of the storm. I think we are working in chaotic and complex healthcare systems that have become increasingly more complex, and technology has introduced a complexity as well as potential simplicity for how we deliver and support that healthcare. So I can see that working on the skills where we are the calm centre, I think that's what nursing has always been, that we are good at looking at a big picture, but that we really need to hone those skills for future development of being the still spot while that chaos and that complexity swirl around us, so that we can be best poised and best placed to have the voice of sort of like reason and opportunity for how all of those parts can connect up for the betterment of the consumer that sits in front of us or lays in front of us or is at the other end of a phone. I will say thank you very much for the opportunity for presenting, for being included. Yes, it was a great honour, and thank you very much indeed.